people, I mean, everybody makes fun of the US healthcare system. And it has huge flaws, but the benefits are these. You can get access, if you can afford it, right on time. There are multiple muscular dystrophy, and maybe it's the population size, but I'm sure we have a huge population size of disabled people. They have their own events, they have walks, they have social gatherings, they have summer camps for, you know, muscular dystrophy. We would, we would have difficulty stepping out of the house because, oh, our child's disabled. And we need to get out of that. We need to stop. Our kids have amazing, smart, beautiful minds. We can channel those minds to do so much for this world. People have perfectly healthy bodies and they're dumb, sorry. So we use what we have to give them a better quality of life. And for that, the mindset or the mentality change starts with us. And then it's passed on to our kids and our surroundings and friends and family and relatives. But if you don't start it yourself, if you keep saying, oh, my child is suffering, yes, no, your child has a disease. This is her life now. Don't use that negative connotation to describe your child. Your child is a lot more than SMA. She's a human first, or he's a human first. And I think I don't know if I'm gone over my time limit.
That is a very inspiring, session, because when you say that treat us as a human first, which is
Exactly.
oh God, that's a very a strong word, and we hope that all parents can think like you do. So thank you so much, Mrs. Modiani Chani, for your sharing experience, and we hope that your daughter will grow better and better every day, and inshallah, many more will follow your daughter's footsteps, inshallah.
Fingers crossed. Prayers for that. Thank you, everyone.
Thank you. Ladies and gentlemen, next I am honored to introduce our second speaker, Dr. Najin Hussain, an assistant professor at Department of Microbiology and Molecular Genetics, University of Punjab, Lahore, Pakistan. Her field of specialization is in human immunogenetics. Dr. Najin is a profound scientist and scholar who have produced more than 30 publications. In 2018, she won an innovation award on rapid strip assay for the diagnostic of dengue, typhoid, and malaria. She has presented research work internationally in several countries, such as Japan, USA, Thailand, Netherlands, Switzerland, India, and UAE. Ladies and gentlemen, please welcome Dr. Najib Hussain, and her presentation title is Immunogenetic Aspect of Spinal Muscular Atrophy.
Thank you, Siti, for introducing me. Let's talk about the immunogenetic aspects of spinal muscular atrophy. So let me share your slides with you people. And it's a great honor for me to present on immunogenetic aspects of spinal muscular atrophy. Let's start with the basics of spinal muscular atrophy. Weakness and wasting, which is commonly known as is the skeletal muscle.
As you all know that skeletal muscles are the muscles used for movement. It is caused by loss of motor neurons that control muscle movement. The weakness tends to be most severe in the muscles that are close to the center of the body, that is proximal, as compared to the muscles connected to the body. There are many typical types of spinal muscular that are caused by changes in same gene.
Excuse me, Dr.
So
Nagin.
in case
Dr.
of
Nagin,
onset and severity,
Dr. Nagin, your
Yeah.
voice we cannot hear actually. So it's too low. Actually, nobody can hear the voice.
Okay, let me start again.
Okay, okay.
basis of spinal muscular atrophy. It is a genetic disorder.
So assalamu alaikum, Cora. Cora, my suggestion is we just give a little time to Dr. Nagin to get started with the slides. In the meanwhile, we can go to the next speaker.
Yeah, okay, sure.
And I would like to basically really welcome with full heart Prof. Zulfalil, who got time to join us. He's one of our mentors and he's one of the key person in spinal muscular atrophy working in this region. So thank you so much, Prof, for joining us.
Thank you. And I also would like to welcome Mrs. Shakira Jamil, our president of SMA Malaysia. Thank you for coming, Mrs. Shakira. Okay, since Dr. Najin having some technical problem from her side, is it better if we continue with the next speaker first, and we'll come back to her after that? Okay. So, ladies and gentlemen, we are honored to introduce you our speakers, Miss Javaria Malik, well known with a nickname Miss Jia. She is SMA type 3 patient and she is a professional transformational life coach, NLP practitioner, and inspirational speaker. She is from Lahore, Pakistan, but currently she lives independently in Dubai, away from her parents and caregiver. She believes that it's our mindset that can deal with anything, no matter what kind of medical condition we are going through. And today she will share with us her experiences in the presentation titled Living a Full, Motivational and Disciplined Life with SMA. Without further ado, please welcome Ms. Javaria Malik.
Hi everyone, Assalamu alaikum. Can you hear me?
Yes, yes.
Okay, and can you see the slides as well? Because it's my first time I'm using this platform.
Have you uploaded?
Yeah, exactly. I'm just sharing my screen. So can you see my screen?
Unfortunately, we can see your screen, but not your slides.
So can you, I'm sorry, I didn't get you. What are you seeing right now? Are you seeing my screen, which is written that living a motivational and disciplined life with SMA?
No.
Okay, let me do it again.
You have to click the share content and then you pick option, Javaria.
Yeah. I'm just doing it again. Just let me know.
Yep, I think something is coming now.
Yeah, I think now is it.
Okay.
Yes, correct. So the floor is yours.
Yeah, okay. This took very much. Side.
Yeah, okay now. Ms. Javaria, you can continue, please.
I think the issues are we are okay, great. So as we all know that what spinal muscular atrophy is, most of the people over here, I'm sure they have someone, even their children, or they're suffering themselves with these conditions. I'm going to talk about SMA type 3 today, as per me, because I'll tell you my age as well, because it will be more, maybe you are here who are 33 years old and you can relate the symptoms. So type 3 symptoms are, we have difficulty in running, and then we have difficulty in climbing the steps. Raising from high chairs is easy for us, but raising from low chair is difficult for us. And the interesting part of SMA type 3 is, which I really like, that not every person, even the same age and same condition, same type, they are automatically different. I'll share a short story. As I live in Dubai, right now I am visiting my parents for Eid. So I remember last year, a guy came to Dubai. He was from Saudi. And what he told me that he can't walk more than 10 steps, same age, same type. And when I asked him why, he said, because this is a progressive condition. And doctors told me that you don't have to do exercise because exercise will deteriorate your muscles. So just be like this because it's a progressive condition. So I'm looking for the other treatments. And I was shocked at that thought, that why is he doing that? But later I realized that it was not his fault, because sometimes it is our society, it is our, the pattern, the behavioral pattern. Parents, they don't support us and the community doesn't support us. So let's go towards the treatment, that what treatment I am going through. For me, I have tried each and every treatment, not the drugs, but I'll tell you about the occupational therapy and physiotherapy. Now it's been, alhamdulillah, 9 years I'm into physiotherapy. Physiotherapy doesn't mean only the stretching or doesn't mean no strengthening exercise. I love going to physiotherapists and I love exercise now, because not only the normal exercise, the strengthening exercises, because I know it is a progressive condition. But can we just focus on not the progression, but we can stop it. We can slow down the condition, and we can other normal people are living. Stretching is also really, really good. I have been meeting a lot of physiotherapists. As you know, Dubai is a hub of different nationalities. I went to different doctors, and they told me, I went to different trainers who were going with the strengthening exercise, and the other physiotherapists from different countries, even from UK as well, from USA, from Lebanon, different countries. And they all told me that stop doing exercise. I was shocked that I always, look towards, I thought only in Pakistan or Pakistan, India, Bangladesh, these are the countries which stop us from doing exercise. But when I thought that why their mentality is like that, they again, because they don't even know what spinal muscular atrophy is. They know what MS is. They know what is muscular dystrophy. But when it comes to SMA, they are like skeptical that what should we do? So stretching is also really, really important, not the normal stretching. You need to go at the end point where you feel that, okay, now you might feel like that it's going to break your bone, but trust me, it doesn't break your bones, because you need to have a better practitioner for that. And then for the hydrotherapy, I feel it's the best thing, because a lot of things which we can't do while we are walking normally, but there are a lot of things which we can do while we are in the pool. And sometimes, everybody's body is different. SMA type 3, even you have same condition, but the body type is different. So you need to understand your body type while going towards strengthening exercise. You won't see the result in a day. It will take years. That's why I'm saying, for me, it's been before coming to this treatment. If I tell you that I diagnosed myself at the age of 29, officially, sorry, I got diagnosed at the age of 29, but before that, nobody told me what's wrong with me. Everybody thought that, okay, I have, more weight, so I am a lazy person. I went to a lot of doctors, but they said that it's just, weak muscle, so you have to live your life like this, and maybe in the end you will have wheelchair. So that thing hinders my mind. No offense to be on a wheelchair, but for me, I have a mindset that no, I don't want to be on a wheelchair forever. Like this is like no for, there is no word wheelchair in my dictionary. So I started researching on it on my own. And then I sent some of, the emails to some doctors in America, and they told me, okay, go for biopsy and the other, the EEG tests. And then I went through that, got to know that I was diagnosed twice, because first they told me in Pakistan, they told me I have limb girdle muscular dystrophy. And then later at the age of 29, they told me, yeah, okay, you have spinal muscular atrophy. So my parents are very, very supportive. So I think that they play a very important role in my, treatment. That's why I have no pity thing for myself. And now let's go towards the challenges which we people with SMA are facing. Okay, so when we say that someone has spinal muscular atrophy, yes, sometimes the world is full of loss for them. But do you know the world is only full of loss for them if we believe that? I know that majority of the people with SMA, they have the type 3, they have invisible condition. While traveling, if I book a wheelchair, because sometimes, I don't know, I can't climb stairs properly, so it's better to be on a wheelchair than to travel those airline stairs. So I asked them to book a wheelchair for me, and they said that, why? What happened to you? Did they start looking at my legs? And I'm like, literally, I used to get annoyed, and I said, I can't climb the stairs. Now, why? Did you got an accident or such, such stupid questions they used to ask. It's not in Pakistan, it's like everywhere they do ask. And of course, we have issues getting the job. I always was running after my careers. I always thought that, okay, I want to do 9 to 5 job, and it attracted me, but we can't do 9 to 5 job because we have to take care of our body as well. Stressing out will deteriorate your muscles. That exercise won't deteriorate your muscles. Stressing out will deteriorate your muscles. If I have same rights, not only me, all the SMA patients have same rights as the one on a wheelchair. The condition, I don't know why people want to see the medical condition on our faces because when I walk, you'll see, okay, this girl is perfect, she has no condition. Sometimes I stumble only when I am, skipping the exercise for 3 days or 4. I don't even stumble. I had scoliosis, but now I worked really hard on my back and my body, so I don't have scoliosis. Alhamdulillah, it's just a little curvature on the, the upper side of my neck. And of course, this thing, when it comes to relationship, married to you if you have any kind of condition. I'm being honest here, being authentic here, that I know a lot of girls are facing this kind of problem. My parents wanted me to get married at the age of 23, but of course, when they told them that she have this kind of condition, they said, oh, and we are sorry. So I think that the girl shouldn't depend on getting married, because I have seen, as Mudhiya was telling, that in America, abroad, there are people who are getting married. And yes, I have seen them. For that, we need to raise our mindset that, okay, so this kind of person I am attracting. My parents always told me, and I think at some point it's really great, that nobody is going to be with a sick person for 20 hours, because it's a human nature. We can't take care of that person for 24 hours, right? So you have to be somehow work on yourself. You have to work on your mindset, that how to build your independent life if you have SMA type 3. So when I talk about rights and responsibilities of parents of individuals with a medical condition, your parents has to be, they have to be very much supportive. Patients with SMA, they can go in severe depression. At the age I was in a depression for a year. I didn't go anywhere after finishing my university, but my parents didn't knew. I belonged to a village in Sultan, and over at that time, but that's the thing which was hindering me, because I used to compare myself with the other kids, that if they can do this, why can't I do that? And my parents didn't knew that why am I in depression. So yes, thank God they supported me. It takes a great courage for a mother to send her daughter abroad without any caretaker, without her parents, And I remember last year, I fell down in a washroom and it was really difficult for me to get up. It was a bathtub. I don't usually go into the bathtubs because I don't go. But half of my body was in bathtub and half was out. And I literally cried that I don't know how do I, come back. It literally took me 1 hour. And then I dragged myself. I came out. I cried. My lips were all cut. The cheeks were all swollen and they were bruised. I told my parents. My mom was upset. But I don't know why people tell me that don't be a hero. Trust me, I'm not being a hero. I don't want to be a hero. But I have a mindset that nobody is going to be with you forever, right? At certain age, of course, people die. You will be stuck. Maybe it's you. If it's not me, maybe it can be anyone. So you have to prepare yourself for that. And of course, this is my favorite thing. That's the thing which took, that made my mindset that I can do anything if I can go, I can live my life independently. The human brain is wired like that. We focus on the negative thing. We focus on the negative things. So can we for a moment focus on our strengths rather than focusing on our weaknesses and focusing on our fears? So that's where we can literally, I don't know about the normal people, how they work, but trust me, I believe that SMA type 3 people, if they work on their mindset, if they work on their body, they can literally do miracles. And other SMA types, I don't know about them. But of course, if they can't do anything themselves, their parents, as Mudhiya said as well, that the parents should develop that mindset that they keep guiding, they keep inspiring their child, and they can achieve miracles. And if you believe in miracle, you're going to attract one. So you need to, I know it's really difficult. For me, it was difficult to accept when I see other people they were doing different things, and me, I was lacking. I always focused on my career. I'm an international certified makeup artist, and I am a chef as well. But what happened? I was focusing on my career. I was not focusing on my health. So I was losing everything, my health as well and my career as well. I skipped exercises for 3 months when I was running after my career, when I was, new in Dubai. What happened? I had to come to Pakistan because I was not giving time to my exercise. I was not doing exercise. I was doing nothing. And I can't even tell you, my health was getting so bad that I couldn't even hold a glass of water. I couldn't feed myself. I stopped eating in front of everyone. It was really difficult for me to take a bite from a spoon. And I was so embarrassed. So then I realized that, okay, now you have to. Now, it's been a couple of years I have started focusing on my health. Now, when I got health, now I'm achieving other goals as well. So you have to make yourself, aware that what is your purpose in life, what makes you attract if you want to make your health a priority. I believe that you have two choices. Either sit back, cry forever on your condition and wait for the treatment, or at least you can face the fear and see what's on the other side of it. And I'm going to share a few videos. They're going to be like, I got a request. So do I have to accept?
Yes, please.
Oh, okay.
Proceed, yeah.
Okay, so I'm going to share some videos about my extra. Oh, sorry, I think it's not here. I need to see if I. I think later I can share. It's going to be on my cell phone. It's not here. It were just few seconds videos. So if you give me some time and we can go to the other speaker.
Sure, Jay. Thank you.
And if you have any questions, you can ask. I'm here right now.
Anyone who want to ask any question, just raise your hand so that we can unmute you and you can ask the question from Dr. Javaria. So you can ask the questions from her, inshallah.
Or maybe I can start to ask you a question because, because we are almost at the same age, and I'm really inspired by you, Jia. Yes. Because you said that you do lots of exercises. What about a diet? Do you have any specific diet to keep your feet and in shape, not to, I mean, like, yeah, because we are easily
Yeah,
to.
that's an amazing question. Yeah, I have personal nutritionist, and I have a sweet tooth as well at a certain time. So what I have, felt that if I am regular 6 months, if I'm into healthy diet, I actually feel so active. So she gave me 7 meals, which are, no carbs. It's healthy. They are healthy carbs and healthy protein, but only if you stick to it. For me, I have a sweet tooth. After her meal, I go for sweet, desserts as well. But I have heard that, these chocolates, cakes, they are poison for patients who have SMA, and even pasta, rice, and these carbs. So try to avoid those, because once I avoid those things, I feel so energetic. And when I eat, sweet things, my body gets swollen, my eyes swollen up, and that's, the bad thing, which is triggering me. So I have realized that sweet things trigger your body. And even sometimes I had bruises as well. I'm allergic to few foods. It's like mushroom. Whenever I eat mushroom, I had bruises on my body.
Yeah, what about caffeine, like coffee or some drinks like tea? Will it affect you or?
It sucks magnesium. So if I take coffee, so then I take magnesium as well. I'm taking supplements. It's from Germany, Sultan company. It's a vegetarian, and it's 500 mg. It's a magnesium complex. And somebody with SMA told me that you have to take that. And then I take fish oil. These are the two, supplements I'm taking on. And when I'm doing the exercise, because I'm doing really, really tough exercises, I don't know, unfortunately, I couldn't show you the video, though I saved it, because if you're going to see those videos, you'll say, I can't believe that you can do such stuff. Because I have posted on my videos on SMA platform, and they are like, we haven't seen someone doing such kind of exercises, especially the SMA person. So I think when you are doing the strengthening exercises, you have to take BCCA, because it will recover your muscles. Because for us, it takes, like for me, if you ask my routine, I do 4 days the strengthening exercise, and 2 days I'm doing hydrotherapy. That's the exercise in pool.
Well, that's a lot of lots of ingredient, or maybe Gia, maybe you can list it, or we can share with the others, maybe because every individual is different, right? But at least we have some, we can call it as a guideline. So for all the young adults,
At least you can try it, because everybody's body is different. What I believe is, if your mental well-being is, your mental health is strong, then you can do anything. Then you can make your physical body active as well.
Okay, sure. So, anybody who'd like to ask Miss Javaria Malik, or you want to write any question in the chat box, you can do so. So maybe we can move to the next speaker. Thank you very much, Miss Javaria.
Thank you.
Can I ask one question?
Oh yeah, yes, please.
Yeah, I have a very important questions, because one of the criteria for severity of the disease, like we have Prof. Zelfalil also is one of the most expert person here, so even we can request his point of view also. My point is actually, the expression or the level of SMN2 gene itself, or SMN1 gene itself, is one of the criteria for the severity. Do you think, or anybody of these nutritionists, or all these people which have been talking to you since long time, did they ever consider, like, to personalize you with respect to the level of your gene expression or something till now?
No, to be honest, they don't. They never, because they don't even know what is it. Even if I'm talking about physiotherapists, the specialized physiotherapists don't even know about this thing. I mean, they don't even know what is spinal muscular atrophy. So the gene thing, so the gene thing comes later.
Okay. So, Prof, if you're around, Prof Zulfali, if you're around, you want to comment? I think Prof is maybe okay. For I leave the mic to you now.
Thank you so much. Thank you.
Okay, thank you again, Ms. Yah, for your experience, a series of heartbreaking, heartwarming, and inspiring moments. Such inspirational for us, especially for the youngsters of SMA, to be more independent. Okay, ladies and gentlemen, moving right along. So, my pleasure to introduce our speaker, Dr. Fatima Batul, the Secretary, Pakistan SMA Bank, and also working as a house officer at Sir Gangaram Hospital, Lahore, Pakistan. She is a doctor as well as a SMA patient type 3. This is considered as twofold relationship with SMA, as she understands SMA as a medical doctor as well as a person who experienced it herself. Without further ado, please welcome Dr. Fatima Batul with her presentation title, Spinal Muscular Atrophy and Life with SMA in a Glance. The floor is yours, Dr. Fatima.
Assalamu alaikum everyone. Can you hear me?
Yes, Dr. Fatima, proceed. You can proceed.
Assalamu alaikum. Hope you all are doing well. As already introduced by Siti Safura, so I'll progress forward. I will not introduce myself. As you all know, I am a doctor as well as an SMA patient. So my presentation also consists of two parts. First, I will discuss some theoretical knowledge about SMA, and then I will present the patient's perspective about life with SMA. That is the problems being faced and how we can overcome those problems as per my knowledge and experience. So the title of the presentation is Spinal Muscular Atrophy and Life with SMA in a Glance. What is SMA? Spinal muscular atrophy is a rare genetic neuromuscular disorder that robs people of physical strength by affecting motor neurons in the spinal cord and consequently taking away the ability to walk, eat, or breathe. So what is the cause? SMA is basically caused by a deletion or mutation in the survival motor neuron gene 1, SMN1, and it is inherited in an autosomal recessive pattern, which means that the disease manifests itself when a person inherits two defective copies of SMN1 gene, one from each parent. And the carrier rate is quite high. About 1 in every 50 normal individuals is a carrier of spinal muscular atrophy. Now let's move towards the management. I will cover it rapidly. Management consists of three parts: history and examination, diagnosis, and then the treatment. So what will be the history in case of SMA patient? Symptoms with which the patient presents depend upon the type. Generally, SMA patients have a history of delayed milestones or loss of achieved milestones due to disease progression. So there are 4 types of SMA. There is yet another type, that is type 0, in which the presentation is in the fetal life, and it can lead to an abortion or breathing difficulty, etc. So let's move towards the type 1. Type 1 patients usually present before 6 months of age with difficulty in breathing and swallowing, and they can't sit unassisted. Then comes type 2 patients. They present between 6 to 18 months of age and they achieve the milestone of sitting, but they can't walk. They have a progressive difficulty in swallowing and breathing with every passing day. Then comes type 3 patients. They usually present after 18 months of age. They achieve the milestone of walking, but they have difficulty in standing up from sitting position and going up and down stairs. On walking age. It really present in adult age, and it is between 18 to 30 even for that, and the symptoms are similar to type 3, but they are less. Then comes the exam. So upon examining the patients with spinal muscular atrophy, what are the findings we get? Include for atrophy, usually have floppy muscles, and then reduced or zero muscle power, reduced or absent reflexes. They do have fasciculations. Usually SMA patients have tongue fasciculations, and it is pathognomonic for SMA, and all types really have this sign. At later stages, there can be skeletal deformities like limb contractures, scoliosis, and hip dislocation. Then comes the diagnosis. The confirmatory test for SMA diagnosis is genetic testing. It detects SMN1 gene deletion or mutation and number of SMN2 copies. Other tests which have a supportive role in SMA diagnosis and in excluding other neuromuscular diseases are EMG, NCS, and creatine kinase level. Now, the treatment. Treatment is covered under several headings. Pharmacological, all are very well aware of the pharmacological treatment. That is the very well-known drugs Spinraza, Zolgensma, and the Risdiplam, which is yet to be approved by FDA. Then comes the non-pharmacological. This basically aims in improving the quality of life, and this includes physiotherapy and the nutrition. Then comes the surgical care for skeletal deformities and for nutrition and respiratory purposes. Then comes the respiratory care, which means that the SMA patients, especially type and type 2, should have access to the equipments which are used for ventilation or clearing the airway secretions. Now let's discuss the pharmacological one. This includes Spinraza, which is the first FDA-approved therapy for SMA and is approved for all ages and SMA types. It is given as an intrathecal injection directly into the cerebrospinal fluid, and it must be taken for individual's lifetime. But unfortunately, we don't have any SMA treatment available in Pakistan except 2 children who are getting Risdiplam through an expense program by Roche. Then comes Zolgensma. It is a one-time treatment, and it is also called gene therapy. It is the second FDA-approved treatment for SMA for all types, but it has an age limit, that is, it is only approved for years of age. To medication only gives you SRK015, LMI070, AVXS101 intrathecal. It is basically the same gene therapy Zolgensma, but in adults it will be given through intrathecal, and that is in the trials. Then come to the non-pharmacological treatment. Physiotherapy or exercise, as already told by Javaria, that how important it is. This is very important to encourage mobility in SMA patients. They should have active but non-fatiguing exercises, and the goal should be to maintain range of motion, increase muscle flexibility, and to prevent contractures. Then comes the importance of nutrition or diet in SMA patients. Ensuring optimal calorie patients to use weaker muscles to their maximum capacity. So a balanced to benefit SMA people better breathing, stronger immune system, and improved growth and motor function, all of which contributes to an overall better quality of life. Then comes the surgical. SMA patients, especially type 1 and type 2, usually need surgical care. These interventions usually include protection surgeries for scalp joint disc lightness, gastrostomy to meet the optimal daily dietary needs. Then I'm going to discuss it at the end, but it is most important, the respiratory care. So usually type 1 and type 2 patients have breathing difficulties and they are unable to clear the airways because of a weak cough. And they are more prone to have respiratory tract infections and aspiration pneumonia. So SMA patients must have an access to equipments for assisted ventilation and for clearing the airways. And these equipments usually include BiPAP, cough assist machine, and a portable suction machine or a mechanical ventilator, etc. Now let's move towards the other part of the presentation, that is a patient's perspective about life with SMA. So living a life while having the disease itself is that there are only a few people until being parents or caretaker can we overcome these problems. There first and the of the world except a few well-developed. Then comes the lack of awareness. This is yet another important issue. General public and even some doctors don't know what SMA is. For instance, I would like to quote. I went to a neurologist in the beginning of 2019 in last year for some problem other than SMA. And when I told him about Spinraza, I was wondered to hear that he doesn't know about any FDA approved treatment for SMA, although he was a very competent neurologist of his field. I believe is a factor that leads to many other problems. And pathological impact. The result, which are labeled as disabilities. Having some kind of disability is unfortunately considered a stigma even in this era at some places. And this then leads to a state of self-isolation and a feeling of an inferiority complex. Then comes the delayed diagnosis. There are several factors which are responsible for delayed diagnosis, and this again coincides with unawareness. First of all, negligence at parents or caretakers level, like if a child is not achieving milestones at right time, they don't pay much attention and choose to wait and see until it progresses. Second condition is that the parents don't know to whom they should visit for their child's condition. Like they usually visit local GPs and they keep on giving them multivitamins instead of referring them to a neurologist. Thirdly, sometimes even neurologists are unable to reach a diagnosis. As Javaria told, she got 2 diagnoses initially of a muscular dystrophy, and then at the age of 29, she got the diagnosis of SMA. So, and if you are lucky enough to find a competent neurologist, then comes the problem related to diagnostic facilities. Like, as I discussed, the confirmatory test for SMA is genetic testing. So, the genetic testing for SMN1 gene is too costly and is not done at any government sector hospital in Pakistan. Then comes the problem of economic burden. Another important issue that a family having a child with special needs like SMA faces is the economic burden. We don't have any such insurance system or government policy to give a helping hand to such families to cover medical or other expenses like education, etc. Then comes the education and job. Educating a child having a disability or doing the job while you are having a condition like SMA is also not an easy pill to swallow. Like, as the schools or workplaces are not at all accessible as needs of an SMA patient, schools and those that we have are not up to the needed lack of expertise, equipment. We do have many neurologists, but there are very few who are specifically specialized in neuromuscular diseases or specifically SMA. So can you people listen me?
Now, okay, Dr.
Yes, we can.
Yeah,
okay. Your friend told me that I can't hear. Patients need to have specially in mind the effect on their posture, but we are lagging behind in this too. So there is a very poor condition. And last point, the lack of data or research. Research is an important field, but we lag much behind in this as well. For SMA,
Dr. Fatima, are you with us? I think the line is quite
parents in order to provide
Dr. Fatima, we couldn't listen you actually. There is some problem with there's an interruption because of I think your internet. So I think you need to repeat the last 2 points again. Can you listen us now? Okay, can you please the last 2 points you can the last number 8 point you can repeat again because your voice was interrupted.
Okay. Okay.
I think for her, because it's a lot of interruption, can we move on? We can give a chance because we are lacking time. We need time from Mita, and then later with Nagin is also there. Then we also need the closing remarks from the experts.
Okay, so we move to the next presenter. Okay, thank you, Dr. Fatima. I'm so sorry because the line is not very conducive at the moment. But again, I would like to thank Dr. Fatima Batu for sharing with us her experience that motivated her to help others in inspiring, educating SMA patients and families, especially in Pakistan. Okay, before we move to Dr. Najin, I would like to welcome our distinguished guests, the Honorable Professor Dr. Zabidi Azhar Muhammad Hussein, the Pro Vice Chancellor in Academic of International Medical University IMU Malaysia, a medical professor with specialization in pediatric neurology and medical education, the council member of the Malaysian Medical Council, and also the medical advisor of SMA Malaysia, and also the respective of Dr. Zulfadil bin Ali, professor of medical genetics and consultant pediatrician and clinical geneticists in Universiti Science Malaysia, the founding president of the Malaysian Society of Human Genetics, and the deputy president of the Genetic Society of Malaysia. Thank you, Prof, for joining us tonight. It's a great honor for us to having both of you in this webinar. Okay, without further ado, ladies and gentlemen, I would like to again introduce our speaker, Dr. Najin. Dr. Najin Hussein, an assistant professor at Department of Microbiology and Molecular Genetics, University of Punjab, Lahore, Pakistan. Her field of specialization is in human immunogenetics. She is a profound scientist and scholar who have produced more than 30 publications. In 2018, she won an innovation award on rapid street essay for the diagnosis of dengue, typhoid, and malaria. She has presented research work internationally in several countries such as Japan, USA, Thailand, Netherlands, Switzerland, India, and UAE. So, ladies and gentlemen, please again welcome Dr. Najin Hussein and her presentation titled Immunogenetic Aspect of Spinal Muscular Atrophy. The floor is yours, Dr. Najin. Dr. Najin, are you with us? Dr. Najim?
Fura, can I suggest if Dr. Nagin still needs some time, can we move on to our ma'am Mamita Ghosh from India? Okay, she's already there. Okay.
Okay. Okay.
Fura, can we move on if Nagin is having an issue?
So we move on to
We'll see
Mrs.
if
Mamita.
if she's able to share the content because she got some issue with the slides.
Yeah.
I think we can still move on. So once she's ready, then we can give her a time because I think we are already ahead of the time.
Okay. Okay, Prof. Okay, ladies and gentlemen.
Okay, I think she is okay. Okay.
Okay now? Okay, okay. Dr. Najim, please. The floor is yours. You can start now, Dr. Najim.
We have requested Dr. Nagin actually to just move on to the next part, in which is the immunogenic part, which was first part she was already into the video, so we don't want to waste the time. We'll just move on to the next part. So just be presenting from that part, inshallah.
Sure.
Fura, can you listen me, Fura?
Yeah, I can listen to you.
I think we should move on because we can give her the time later because we are already running short of time.
Oh, okay, sure.
It's a person they've been waiting, so we can give her the time after this. Let me move on.
Okay, okay, sure. Okay, ladies and gentlemen, please forgive us with this with some shortcoming of online technical problem. So we move to our last presenter. We are honored to introduce our fifth speaker, Mrs. Momita Ghosh. Mrs. Momita Ghosh is the co-founder and director event and family support for an organization named Cure SMA Foundation of India, which is a parent-led community working for the welfare of children affected with spinal muscular atrophy in India. She is also a strong, loving mother of a beautiful 9-year-old daughter, Domoshpita, who is SMA type 2 patient. We are so lucky today to have her to share with us her experience as an educator and one of the founder of a big SMA community support organization in India, and also a caregiver of SMA patient. Her presentation title is Holistic Management of SMA, a Parent Role. Ladies and gentlemen, please welcome Mrs. Momita Ghosh.
Yeah, hello. Yeah, can you all hear me? Hi, can you hear me?
Yes, ma'am.
Yeah. Thank you so much, SMA Pakistan SMA Bank, branded educators, and SMA Malaysia for this opportunity to share my journey with SMA with you all. Yeah, it's and there's wonderful presentation by Dr. Batul and the story of Modia, definitely, and inspiring motivational talk of Zavaria. And really, I'm very happy to be present here. Mr. Atif, can you share my presentation here? Means it seems that I'm not able to share the content here. I'm trying. Yeah. Um, just share screen.
Yeah, sure, man. Just give me 1 second. I'm just sharing the screen, and then you can move on.
Yeah, please. Yeah, thanks, Dr. Atif. Yeah, thanks. So, so it's a, just move to next slide. So I will just share my journey, and along with that, I will try to create and I'll try to guide you all about how we can create an environment more SMA friendly, and we can move towards the accessibility of treatment. So my journey with SMA started in 2012 when my daughter was diagnosed with SMA. And before that, definitely there were some milestone issues and all those things. But as it happens to every parents, that we think that everything is normal with our child, nothing can be wrong with our child. So my child was a very normal child till the age of 7-8 months. Then she suddenly stopped crawling and moving like from here and there, and then we thought that something is wrong with her movements and abilities. So we met her pediatrician, and he then suggested some tests, and in that way we came to know this diagnosis, spinal muscular atrophy. So before that, we were not aware of this disease. Even anyone around us, around me, being I am in a medical profession, I'm optometrist by profession. Even the doctors around me were not this disease. So when I come to the diagnosis of the disease, and they said, oh, this is a small topic in our one of the chapters, so hardly we know what happens in this disease. So is knowing the disease, understanding the disease, being a parent, and then fighting this disease. So just move to next slide, sir. So what happens that when we went to the doctor with the diagnosis, the doctor told that your child is not going to live beyond 2-3 years of age. So try to give her, as Modiha also said, love her and give her whatever you want, but her life expectancy is not more than 2-3 years of age. Even the doctor suggested us not to send her to schools, because for SMA children, respiratory infections are fatal, and in schools with lot of children there, and continually they are getting respiratory infections, so that may become fatal for your child. Sir, can you move to next slide, sir? Yeah, just keep that because it's already been discussed. So I'll not discuss what is SMA and what all. Next slide. Yeah, and these are the few symptoms I would like to discuss because every for parents it's difficult to understand actually that something wrong is with your child. If so, what happens that when there is a gross regression in milestone, like the child is not crawling, the child is not standing, the child is not walking, then only we can, we are alerted that something is wrong with our child and we need to check with doctors. So when we go to the doctors, then again it's a challenge to get the diagnosis because it's very rare. So there are few symptoms already been discussed, that regression in milestone and then recurrent respiratory infections, and hypotonia is one of the major symptoms that is missed by many doctors as well, because it's not very common, but then hypotonia is a main symptom. We can if we are aware, if we are careful, we can diagnose SMA earlier. Next slide, sir. So then again, next slide. This has been discussed by Dr. Batul. So
Ma'am, can you listen us? Hello. Aurora, can you listen me?
Yes, Prof.
This issue with the internet in Pakistan and India.
Yeah, I think so.
For we take this opportunity. Actually, we got a very good chance to listen to some experts here. We can request, if possible, Prof, to join us. Fora, can you invite?
Yes, Prof. We would like to invite Prof. Zabidi or maybe Prof. Zifali, because both of them are a very great team working together in SMA Malaysia, SMA in Malaysia, but for some time back in early 90s and 2000, I believe. And maybe Prof. Zabidi or Prof. Zifali would like to share with us your insight or maybe your experience dealing with SMA patient. Prof?
I think, Cora, you invite one by one. Prof. Zavidi, are you around?
Shall we start with Prof. Zabidi?
Can you hear me?
Yes, Prof. We can hear you, Prof.
Yes.
Oh, good. I'm sorry I came a bit late to the webinar.
No, it's okay, Prof. We are very happy you have
So
joined
happy
us.
to be able to interact with you, although I'm not able to see any one of you here. But I'm also very happy to see the energy to see from all of you, organizers of the thing, with this energy and with the vision, courage that you all have. I think we can achieve many things which seem almost impossible in the past. So yeah, all that I have to say. Hello?
Prof, maybe you would like to share with us your experience dealing with SMA patient.
Over the years, we have had we've done a number of scientific work, especially involving details of genetics, together with the team from previous. The work is still going. I think we credit the leader of the group for his Tego team. I think that work has been published in journal. We've also been seeing patients. I said the pace of what we do is fast. We are getting to for the hope as pediatricians. What I can say is that our sometimes when the pediatricians and we feel bit at loss ability to help patients, our SMA patients give us strength to move us further. Think together, tango between patients, pediatricians, inspired us, seeing the energy of Pura and the team, makes us feel that we can achieve more future.
Prof, we have one of the very good presentation from one of the speaker is Javaria. So she said something related with the nutrition aspect in which she has been going to the nutritionist, But we were discussing, even those nutritionists, they have been not personalized till yet, But they have been doing like, they've been giving them different kind of nutritional supplements and all the spec which is needed by them. But like, for example, looking at the clinical severity at the molecule level till now, like it's like a big area to explore, like we can even target their, the nutrition status with respect to the personalized medicine. So that's one of the area we've been discussing like a few minutes back. So I think this is something which we need to bring to our nutritionists and dietitians, who are working in the field also.
Yeah, that is true. So far, I have a feeling that we have not managed to group together nutritionists, physicians, on. We should reach out to them. It just so happened that the International Medical University has a group of people, a specific program, nutrition and dietetics. So I think we can do that, reach out, because there are so many things that, as you all know, are affected when condition is there. So we do need to find ways to boost the nutrition. Fortunately, for the last few weeks, I've been approached by quite a number of nutrition companies eager to find out what else can we do. At the moment, we are dealing with children malnutrition, but we can do more, and expand research to everyone who is nutritional. So yeah, that's a good point. Yes, we do need to identify the technique of SMA and find ways out there.
Prof, yes, Prof,
I will make sure that can.
Prof, like just with our current resources, like we can map their issues and their quality of life with the specific, factors. So these kind of studies we can still bring to even our public health people. We can do quite a lot even now with the caretakers and even with the patients. At least at our behalf, still a big area to explore for them.
If I ask you a question, is that you replying me that you guys are doing the awareness-based events in Malaysia? Can you?
The question, awareness of SMA, is it?
Yeah. Like any inspirational events, are you guys doing it? Because we SMA patients, as you told us about, we can't, every SMA patient is mentally strong so they can come themselves out of this. They take a lot of time in accepting their medical condition. So are you having any setup over there in Malaysia which provides that, okay, so these are the steps, we are there for you, we'll take out from you. We'll take out from this trauma to you. So are you guys supporting them, or how it works there?
We are fortunate. We have very active group. Isapura herself is person in charge. Passion, zeal, and involvement. I was involved once in an event organized by patient, and I feel that there's so many things which is going on handled by IT, which gives a lot of strength in it. So the president herself, are you still the president now?
No, I'm no longer the president, Prof. It's already
she's probably the
here.
role. Yeah, she's probably playing the role of an advisor now. But I think she's leading the show, and we are very inspired by what she's doing.
And I really like what you are talking about, because these things we should need in Pakistan. Forget about should, we must need. Because when I'm traveling somewhere, I see family members, they are having water slides. Because I have heard that in the world they have, water parks for people who have some kind of medical condition, who are wheelchair bound, or who have any other kind of neuromuscular disorders. So this thing must be in Pakistan as well.
The way we are interacting now, international, reaching out to partners, makes us feel that we are sharing a common problem. I think that itself is it's a relief that you're not having the problem. Sort of sharing the issue is already giving strength. But maybe one of these days, when the situation allows, we may go out on a cruise ship and meeting all the patients. Cruise ship maybe. Share we.
Exactly, Prof. Thank you, Prof. Prof, can we also request Prof. Zulfali if you're around to give your comments?
I'm waiting to hear from Professor Saleh. Saleh, are you there?
Yeah. I think he may be some issue with his internet. Prof, actually, this is. I would actually also like to invite if Casper is around. Casper, are you around? Casper, are you listening? So basically, Prof, we just try to bring in a few of the people together. So, but the issue is like at least we come up with the basic guidelines and SOPs kind of stuff, in the start for the SMA community, especially the caretakers and the patients first, and then we'll move on from there. So it's the first, actually the symposium in the series. So we'll be having like for this year we'll be having five. So we'll go more advanced, slowly more towards diagnostic, clinical interventions, everything in the next coming, inshallah, symposiums.
Maybe we can also get other countries involved.
Yes, exactly, Prof. Inshallah, Prof. I think Mamita Ghosh is already back. Mamita, can you listen us? Mamita, can you listen us?
Yeah, I can listen. Yeah, can
Okay,
can
so
you hear me? Yeah.
okay, we'll bring your slides back and then you can just finish it
And
briefly.
you just a request that every 30 seconds or you change the slide so that I
No
can
problem.
continue.
I'll be very fast. I'll make it 15 seconds. Don't worry.
Yeah.
Okay, so you're now on the slide. Okay.
Yeah. So
Right.
I was in the diagnostic. Thank you all again. So, the major challenge in spinal muscular atrophy is to get the diagnosis because the regression milestones and hypotonia, these things are missed. So, first we reach to pediatrician, and then if the pediatrician is not able to diagnose what is wrong with your child, most of the time they'll be telling nothing wrong with your child, but then some problem is there, so we move to senior pediatricians. Then we do a lot of diagnostic tests like MRI, MG and CVs, and then lastly the confirmatory test, the genetic test. A few years back, it used to be the muscle biopsy and all, but now it is very much mandatory for spinal muscular atrophy to do genetic testing to detect the deletion of SMN1 gene and also to find out the number of copies of SMN2 gene. Next slide, please, sir. So this genetic testing is very much important because there are a few drugs on the market now for enrollment of the programs in trial, and whatever we need the SMN2 copy numbers, etc. So the major challenge is the primary diagnostic step, that is pediatrician. So that is very important for us to create lot of awareness among the healthcare professionals so that we get early diagnosis because most of the children will be almost all children will be visiting pediatricians. So if there is anything wrong with any child, the pediatrician should be able to diagnose, and that will come if we do more and more awareness activities. We reach pediatricians with our disease with our disease patient advocacy groups with awareness activities. We'll get earlier diagnosis, and more diagnosis will help us to create more awareness. So next slide, sir. Just keep this slide. This has been discussed well by Dr. Batul, and this is the hurdle I discussed in the pediatrician. So what we have done in India, we try to participate as a patient advocacy group in different conferences of doctors, especially the conferences of pediatrician conferences, neurologist conference, where we go as a patient advocacy group for spinal muscular atrophy, and we share our brochure with informations and with the supports we provide to patients. Because for doctors, like in our subcontinent where population is so much and number of healthcare professionals is very less, so it is very important that once the doctor diagnoses the SMA, they don't know how to support the child, because it is a disease with multi-system effect. So if a patient advocacy group is in the play, then they will be referring to the patient advocacy group, so that we can channelize the patient to the various needs of the disease. So yeah, so this is the most important part of my discussion, is creating awareness. And creating awareness comes in many aspects. It comes, you have to be aware as a parent, you have to aware other people around you about the disease, we have to aware healthcare professionals, we have to aware government, we have to aware the mass population. This is our responsibility. Means my topic is a holistic management as a parent's role. So my role does not end caring my child only, because the part of my care also is creating the awareness of the disease. Because if we are not creating the awareness, my child will again face problem in society, getting availability and accessibility of treatment. And we want our child, every parent want their child to have a smooth life. So creating the smooth road is our role, it's our responsibility. So first, awareness is the self-awareness, when you have to understand the disease, learn the disease, accept the prognosis. That is the most difficult phase for any parents when you are having a child with a genetic disease, because you are the reason for the disease. And thankfully, SMA is an autosomal recessive disease where both parents are equally responsible for this disease. So both parents needs to accept the disease, accept the diagnosis and understand the prognosis. Yeah, now we are in a good era when we have some treatments, but a few years back there was no treatment, so it was more difficult to accept the prognosis that you are going to have a child with a disease which is progressive and your child will lose all their abilities. But still things are still same, because treatments are there, but in this subcontinent accessibility and availability of the treatment is really on the we are not sure that we'll be able to ensure the availability and accessibility and treatment to all. Definitely we are working on that aspect. So then awareness to the healthcare professional perspective. So what we do as a Cure SMA India, we reach healthcare professionals of all we know. We share our brochures, we share our journey with them. Means doctors are wondered to know that we have a children with SMA of 7, 8, 9, 10 years old, because the perspective of them is that SMA child will not live 2-3 years, more than 2-3 years. So we are working hard to change that mindset up, and we are also we are lucky that we have some compassionate doctors along with us who believe to provide the quality life to our children in spite of all those difficulties. So that is also one of the we are working on, to provide a quality of life to our children, and that can be done with the multidisciplinary approach to the disease. Because it is a multi-organ disease, we need different experts from different specialties to manage this disease. And it's very important that every city or every zone, every corner of your country should have that kind of multidisciplinary setup where you can take your child. As a parent will not know what is wrong, what we should do. It is the responsibility of the healthcare professionals to guide us. But then again, as a parents, as a patient advocacy group, we are creating that infrastructure in our country so that our children can get all the facilities they need to have a quality of life. And that's actually motivating. When you are seeing your child deteriorating continually and you can't do anything for your child, it is very demotivating. But when there is a system that a lot of things are being done, it gives us a feeling of well-being that I am doing something for my child. I am, making him or her to wear spinal braces or special shoes. We are taking care of their lungs. We are doing regular lung function tests. We are checking their bone densities. We are giving them vaccines and all. So this multidisciplinary approach and establishment of multidisciplinary care center in country actually changed the scenario of the SMA awareness in India, I should say. Next slide, please. So, after the healthcare awareness in the healthcare professionals, it's very important because healthcare professionals will support you to avail and access the drug. But along with that, we have to create awareness in the government and society as well, as because government is actually the source of funding. They will fund our treatment. So unless and until they doesn't know our struggle, they don't understand our pain, they don't see our children are wonderful with wonderful intelligence, and they are achievers in their in their capabilities. But they are losing their lives and abilities. If we can't make the government understand that we are continually losing children because of this disease, they will not support us. So creating awareness in government is also very important. And what we do in our country, that we meet health department ministers and officials, and we try to reach every political person, every official in government hierarchy with our brochures, with our awareness activities. And we try to do some seminars, we try to do some conferences, and we invite them, we show them how our children are struggling, and we appeal them to support the availability and accessibility of the treatment. So that is a very important aspect of awareness. So as I discussed that there is three aspects of awareness: self-awareness, and then awareness in healthcare professionals, and third is society and government. So we all need to work on every aspect. We need to be advocate for our own children. Nobody else will advocate for our children. We have to understand, somebody can cook food for you, but we have to eat yourself. That is very important. So what are the hurdles in awareness? Hurdles in awareness is as rare incidents. So, to overcome that hurdle, you have to do more and more campaign. You can do social media campaign. You can share your story in newspapers. Newspaper is a very strong awareness medium because, it reaches to mass population in their local language. So share your story in newspapers. And then sometimes, people are not ready to share this kind of disabilities because of the excuse me, social stigma. But then once you accept the disease, you accept the prognosis, you get over of that fear of social stigma. Because I am very proud of my daughter. I am very proud of my daughter who is on wheelchair, but she is an achiever. So, you need to be confident and proud for your child. Then only you can get rid of that social stigma thing. And if you are proud of your child, nobody will look at your child with that kind of eyes that, oh, poor child who is on wheelchair. So it's all depends on the attitude what we have for our children. So, and emotional, yeah, there will be emotional burden definitely, when we see our children cannot walk, cannot move around, cannot do a simple thing like scratching themselves or opening a pencil box or, drink water themselves. Yes, it's definitely painful, but then this is life, we accept that. And yes, having a disabled child is a very high financial burden. So, then as a parent groups, we try to support our families, and we need to create a system where the support system is provided by government hospitals. So, we need to work on that also, that we should get at least minimum support systems like devices like BiPAPs and braces and shoes and nutritional supplements from the government mechanism. So we need to work on that aspect also. Yeah. Okay. Next slide. Yeah. Started. Next slide. Yeah, so this is my wonderful daughter. You can see her wearing spinal braces. She has generalized hypotonia, bilateral hip dislocation. Both hips are dislocated, and as per the literatures for children's, we can't do hip surgeries because it will again get dislocated because of the weak muscles. So it's extremely painful condition right now, sitting and sleeping and everything. Then she has scoliosis in spite of best management, physiotherapy and everything. After certain point of time, due to the progressive nature of the disease, scoliosis increases. So she has to wear that kind of spinal braces for 10 to 12 hours a day. You can understand this a tropical climate, how difficult it is. She will be sweating all over and there will be rashes in her body. But then, we try to do our best, because it's the only possible way to delay the progression of scoliosis. Then she has pronator contracture. You can see her hands with some tapes. We are trying to delay the contracture. She cannot turn her hands, but thankfully she is able to write. And weak respiratory system, which is a a part of this disease, we have to go through it. And poor bone density, which is very important, because the children who are not mobile, their bone density will be weak. So we need to keep checking the bone density, which will again help to will not have the osteoporosis and all, if we keep on checking bone density and we supplement those things. Next slide, please. So this has been discussed. Still, as a parent, we need to understand the management of the disease from parents' perspective. We need to take care of respiratory health. We need to take care of reflux issues as aggravated because of the scoliosis or bending spine. So we need to take care of bone health. We need to take care of the contractures, regular physiotherapy, an hour or 2 hours a day, and hydrotherapy once or twice a week. These things are very important. Actually, I should say that physiotherapy is very, very, very important in spinal muscular atrophy, in spite of all the drugs. Even if you are getting drugs also, you need to continue your rigorous physiotherapy regime, so that no muscles are get contract, and you can keep your muscles active. So So this management, as a parents, we need to understand along with the healthcare professionals guiding. So, this is what I was talking about, the multidisciplinary approach. It is very important, and we have established multidisciplinary care system at least 4-5 places in India. One is in Calcutta, other is in PGI Chandigarh, then Gangaram Hospital Delhi, and then there is another center in Bangalore where this multidisciplinary management is provided to SMA children, and this is very important to establish in each subcontinent. Countries like Pakistan and Bangladesh. We are also working with Bangladesh, so trying to establish such kind of system, because unless and until you are seeing your child getting a quality of life, you will not feel motivated to do anything for this disease. So first, हिंदी में एक बात है कि अपने घर से आपको शुरू करना चाहिए. So it's like that. You have to start with your own child, advocating your own child. Then only you will be able to advocate the whole community. So if you're doing best with your child, that is the best advocacy. Otherwise, if you're not doing good with your child, you are not a good advocate as well as. So multidisciplinary approach is very important. I should suggest that you all should work in your own country to establish such system at every corner of the country. Yeah, so these are the periodic investment. With once the multidisciplinary care system is in place, you know what to do with your child. So every 3 months or 6 months, you need to visit your care center, and you get the regular investigations like lung function test, sleep study, swallow test, and blood works to do these periodical investigations and understand that how your child is in condition, means if the disease is stable, if the disease is progressing. This disease has many spectrum, and many phases. Sometimes you will be seeing your child stable for 2-3 years, and we feel excited and delighted with the stability of the disease, but then suddenly with the growth spurt and puberties and all, this disease suddenly progress with such a aggressive force that you are not able to cope up with that the progression. And then every 2-3 years we need to adjust ourselves with the disease, adjust ourselves with the mobility aspect, adjust ourselves with the supporting aspects. Means we learn the disease in a new way every 2-3 years. Means once we are adjusted to a phase, suddenly there is a change, there is a loss of abilities, there is something major increase in scoliosis or severe hip pains and all. So every 2-3 years we learn this disease in a new way. And sometimes it is frustrating, definitely, but then we keep ourselves motivated seeing the beautiful smiles on our children's face, because they are least bothered with that. They are actually enjoying their life nicely in spite of all these issues they are actually suffering from. So respiratory health management, that will be guided by your pulmonologist. Every SMA child should visit pulmonologist regularly. Pediatric pulmonologist will be who should do the aggressive management of any mild respiratory infections. The apprehensions of using antibiotics and all should not be with SMA children. There should be always aggressive management of respiratory infections to for the survival of your child. Yeah, this is a very important issue, reflux, as Dr. Batul also mentioned that there is a possibility of aspiration pneumonia, and lot of type 1 children are, losing their life because of the aspiration pneumonia. So, as per protocol, there should be the medicines should be given to control aspiration and reflux, and the position maintaining after having food and all. Those things are very important to stop the aspiration. So it is very important in SMA management, this food habit and reflux management. And if you are suspected with aspiration, you have to do the swallow test to check if there is actually any aspiration is there. Excuse me, next slide. Yeah, so I was discussing about bone health. It's very important. Scoliosis is a major complication in spinal muscular atrophy, and every child, mostly type 2 children, will be facing more scoliosis because they are able to sit and they sit for long hours. So spine get cups. So bone density is very important. If your bone is not strong, then there will be scoliosis, more scoliosis, faster bending. So vitamin D and calcium supplement should be there. And then again, in spite of that, because of the lower mobility, this children's calcium is not deposited on bones. So sometimes you need to do bisphosphonate infusion for maintaining bone density. That is usually done 6 months or in a year, definitely with the advice of pediatric endocrinologist and orthopedic and your pediatrician. It's a combined decision, but it is very important. And as well as the standing is very important. We use standing device. We use stander for making them stand. At least ideally it is recommended for 2 hours standing, but with the hip dislocations and all, my daughter hardly able to stand more than half an hour or 40 minutes, but we routinely make her stand with this standing device. So this is also very important management aspect of spinal muscular atrophy. Yeah, so therapies, as I discussed, that it's very important. We do physiotherapies regularly. We do pyrometry for our children, chest physiotherapy and few lung exercises that can be done at home is very important. Means for spinal muscular atrophy children, life is a very routine life, very rigorous therapies they need to do throughout their day to maintain all the muscles activity. So we do physiotherapy, occupational therapy, hydrotherapy, and everything possible we do for therapy to maintain the basic muscle strength. It's a video. I'm not sure we'll be able to play. Just try. If it is not playing, then we can leave it. Yeah, so we combine therapy with her. We actually make her playing tabla and harmonium and all, and we make her sing to strengthen her lung. And these things really helps also in that aspect when children enjoy their therapy with this kind of musical instruments. It can really help in muscle strengthening as well as enjoying your therapy. And then we need to accept the supportive devices. Means for every parent, it's a very difficult moment when you make your child sit on a wheelchair. It's very painful moment, but then once early intervention is always better. The earlier you start wheelchair, you give more independence to your child. So the devices that can help your child to get a little bit of independence, we should start as early as possible. Like wheelchairs, and then we also use this stair climbers, and then other supporting devices to give them the better quality life. And the inclusion aspect is also very important because we need to give our child a social inclusion for overall development of their emotional health. So these children are very brilliant, they get easily accepted in schools and all. Yes, there is a struggle in countries like India, definitely we have to struggle to get them admitted in proper school because a lot of schools does not have facilities to accommodate wheelchair and lift. Not every school comes with lifts and all. So after that phase of struggle, once they are getting admission in the school, definitely they soon get included in the system. So that is also a part of the but we need to keep on advocating for our children in school, make the school aware that what are their needs and how they need to be supported, and how careful we need to be with them, because it's not like USA and UK where school will be providing you the best support. Here we need to be very careful with our children in the school. Some of us, we send caregiver from our home to school to support our children for going toilets and all. uh, that's another challenge for our subcontinent, that we don't have a proper system for disabled children in schools and universities. But then again, we are continually advocating and creating awareness for their need, and definitely we hope the scenario will change and it slowly improve. Mm. Next slide. Yeah. Next slide. Yeah, this. Yeah, so you can see these pictures where my daughter is in school picnics and school ceremonies, and even in the drills and all. So this is, I think, I should say, a total management as a parent I try to give to my child, as well as I'm trying to replicate same model for every SMA children I know. And as a Cure SMA India, we few parents actually formed this Cure SMA India along with myself. There's Mrs. Alpana Sharma, Mrs. Archana Panda. They are also having SMA kids, and we together thought that whatever we are doing, the best possible management with our children should be replicated for every children in the every children suffering from same disease in our country. In that way, we started our advocacy group, and thankfully that basic level of awareness has been created. We are continually working on it because it's a continuous process. It will not stop. Yeah, that is a whole I thought I will be discussing. If anyone is having any questions in particular, definitely you can ask me. And thank you, Dr. Atif, for helping me with the presentation.
Thank you, Ms. Momita. This is very inspirational insight, and I do believe you are advocating people in India through your child, to your daughter, and I believe we still need lots to learn from you to keep the momentum. Our organization, SMA Pakistan, the SMAB, and also SMA Malaysia. I could see that you encourage your daughter to be included in the normal environment, communicating with normal children, so that she will not feel inferiority complex, right? And then I'm interested. I'm quite interested in one slide of yours just now that it shows that multidisciplinary approach where there is several aspects of a medical aid for SMA patient, like pulmonary, acute care, medication, nutritional, and every aspect of it taken care by a specific hospital. If I'm right, or if I'm is it right?
Yeah, actually, for SMA, multidisciplinary management is very important, for every aspects of the disease like pulmonary functions and orthopedic management, spinal management, gastro management, neurological care and pediatricians care, physiotherapy, nutritionist. This is the whole specialist system that we try to accommodate. Like I'm from Eastern India, and we have a hospital in Eastern India, Kolkata. What we do, we do quarterly clinics, quarterly SMA clinics there, where in a single day all doctors are present, because our children are wheelchair bound, and we cannot go on finding doctors here and there with our children on wheelchair. So all doctors will be in a same day, in a same place, and we can get their consultations in a single day. We don't need to carry our children around. So that is the whole idea, to give them the best care under one roof on a same time.
That is a very, very, I mean, like a great system available in
Do you,
India.
for one question,
Sure.
ma'am Mamita, do you think like looking at a parallel, the people who have the family suffering with SMA, the link with them, the way you socialize with them, is it easy, and is it really effective for the kids? Like mixing up with them, it's not a social kind of thing, but like a personal bonding, family mix up. Have you been also into those kind of things?
Yeah. We have sometimes gatherings, also conferences with parent session, children session, and we try to do regional meetings, and we have informal WhatsApp groups, and we connect. We are always a phone call away from our members, I should say. Actually, we tell it as a family. We are a family. That kind of interaction is present. So once we don't know each and everyone's problems and pains, we are not able to support them. So we always encourage that kind of communication in our advocacy group.
What about like, I've been looking at your pictures, the way they've been mixing up in the schools. So I think you have done a quite strong kind of awareness program or some plans, to bring up to the teachers and the community.
Yeah, actually, our children are blessed. They have a very good IQ, intelligence, and each and every child with SMA has exceptionally good in academics and extracurriculars. So once overcome the hurdle of getting them admitted in a school, and they are admitted in a school, they soon get accepted because of their intelligence and cognitive, abilities. So there we don't need to work much. Only thing is that we need to aware the school authorities of their physical needs and physical support. Other things, and I should say that I am blessed to have a school for my child where her friends, classmates, and all, they are also very supportive, and that kind of sensitization is done by the school, and they enjoy having my daughter in wheelchair. They like to push her wheelchair around and will be complaining if she is not. They are not allowed to push the wheelchair. So it's always I tell that we should be proud of the whatever the situations like conditions our children are having, and if we accept, everyone will accept. We should be normal about it. We should not feel that something wrong is up with our child. So I think it's all whole everything is about our own attitude, that how we are dealing with the situation.
Thank you so much, ma'am, and thank you so much for joining us. Inshallah, we'll be planning few more sessions in the next coming series, and it will be great to listen you and some other people from at your SMA India, because I think you are right now moving on a right track with a very good influence, in the SMA families. I even read few of the articles about all of you, and it's just really amazing. So,
Yeah,
thank you so much. And now,
thank
just looking at the time, let us give the last chance again to Dr. Nagin. We still have some time, and let her finish her slides if possible. Dr. Nagin, can you try to share your slides and see if it's working?
Uh, Dr. Atif, would you please share my slides?
Wait. Okay, so here we go. These are your slides, starting from slide number 12. We'll just move on.
Yes, thank you, Dr. Atif. Sorry for inconvenience in the beginning. I am really sorry from the participants. Dr. Fatma has told about SMA in detail regarding the types of SMA, but I will tell you about the immunological and about the genetic aspects of SMA. We will talk about the main gene related to SMA, which is SMN1 gene, because it provides instructions for making the survivor motor neuron proteins. And this protein is found throughout the body with highest level in the spinal cord. So this protein is one of a group of protein called SMN complex, which is highly important for the maintenance of specialized nerve cells called motor neurons. So these cells are located in the spinal cord and the part of the brain that is connected to the brain stem or to the spinal cord. As you all know that motor neurons transmit signals from the brain to the spinal cord that tells the skeletal muscle to tense or to contract and allow the body to move. So in the SMN complex plays an important role in processing molecules called messenger RNA that serve as genetic blueprints for making proteins. Messenger RNA begins as a rough draft and we call it as pre-messenger RNA. Then it goes through several processing steps to become a final mature form. So SMN complex helps to assemble the cellular machinery needed to process pre-messenger RNA. And SMN complex is very much important for the development of specialized outgrowths from nerve cells called dendrites or axons. So dendrites and axons, as we all know, that they are required for the transmission of impulses between neurons and from neurons to muscles. Next, please. There are two main genes, SMN1 and SMN2. Both genes provide instructions for making these SMN proteins. But normally, the most functional SMN protein is produced by SMN1 gene. That's why I've said in the beginning that the main gene which is involved is SMN. while a very small amount is produced from SMN2 gene. Several different versions of SMN protein are produced from SMN2 gene, but only one version is functional, while other versions are smaller and they are quickly broken down. So you can imagine that if mutation occurs in SMN1 gene, it can cause all types of the spinal muscular atrophy that were discussed by Dr. Fatma Batul. The number of copies of the SMN2 genes modify the severity of the condition. This is actually regarding the SMA patients and for their parents, that SMN2 gene number copies, they modify actually the severity of the condition and helps to determine which type develops. So in this diagram, you can appreciate that most people with spinal muscular atrophy are missing a piece of SMN1 gene that actually impairs the SMN protein production. And a shortage of SMN protein leads to motor neuron death, and as a result, signals are transmitted between the brain and the muscles. So muscles cannot contract without receiving signals from the brain. So many skeletal muscles become weak and waste away, leading to the sign and symptoms of SMA, which are discussed by various speakers. Next. Now, typically people have 2 copies of SMN1 gene and 1 to 2 copies of SMN2 gene in each cell. However, the number of copies of SMN2 gene varies, with some people having up to 8 copies. In people with SMA having multiple copies of SMN2 gene, they are actually associated with less severe features of the condition that develop later in life, for example, SMA type 3. The SMN protein produced by SMN2 genes can help make up for the protein deficiency caused by SMN1 gene mutation. So people with SMA type 0 usually have 1 copy of SMN2 gene because it is actually helping out in making up the protein deficiency which is caused by SMN1 gene mutation. While those with SMA type 1 generally have 1 or 2 copies, and those with type 2 usually have 3 copies. With type 3, they have 3 to 4 copies, and those with type 4 have 4 or more copies. So many other factors can be involved, but keep in mind that many factors are unknown and they also contribute to the variable severity of SMA. Next. So in this diagram, you can appreciate that SMA is inherited in an autosomal recessive pattern. Now let me explain that it means what is autosomal recessive pattern. It actually means that both copies of SMN1 gene in each cell have mutations. In most cases, the parents of an individual with autosomal recessive condition each carry 1 copy of the mutated gene, but they typically don't show sign and symptoms of the condition. However, in rare cases, a person with SMA inherits an SMN1 gene mutation from one parent and acquires a new mutation in the other copy of the gene that occurs during the formation of the reproductive cells, such as eggs or sperms, or in early embryonic development. So in these cases, only one parent is a carrier of the SMN1 gene mutation. So in such cases, genetic counseling plays a very, very important role. Next, please. Recently, there have been important. Okay. Now, recently there have been important advances in understanding the genetic and molecular basis of SMA. And keep in mind that next generation sequencing technology has accelerated gene discovery, and 13 SMA genes have been discovered so far. In total, 33 causative genes have been identified, and common pathophysiological themes include defects in RNA metabolism, splicing, axonal transport, motor neuron development, and connectivity. So the most common form of SMA is caused by homozygous disruption of SMN1 gene on chromosome 5, that is the long arm of chromosome 5, and results in insufficient levels of SMN protein in motor neurons. So it is one of the most common autosomal recessive disease, with the incidence of 1 in 6,000 to 10,000 live births, and a carrier frequency of 1 in 40 to 60 adults. Next, please. So let me give you a little bit more picture about the SMN2, because it plays a very important role in SMA. Human possesses a variable copy number of SMN2, that is 0 to 8 copies, from which SMN is slowly derived in patients with SMA. So SMN2 is almost identical to SMN1, except that a single nucleotide, that is a transitionally silent C to T nucleotide transition, causes exon 7 skipping in the splicing of the majority of SMN2 transcripts, producing an unstable form of SMN protein. So again, a very important role that nucleotide chain disrupts an exon splice enhancer sequence, and it creates an exonic splicing silencer elements that binds the splicing repressor, that is heterogeneous ribonucleoprotein. And inshallah, in the upcoming days, we will do genetic analysis of SNN ribosomal nucleoprotein with relevance to SMA. So a small fraction of SMN2 transcripts are spliced to include exon 7 and produce full-length SMN. So number of SMN copies and resultant amount of full-length MSN protein produced in patients with SMA correlates with SMA disease severity. So SMN2 protein copy number plays a very important role in predicting the SMA phenotype, with the majority of SMA type 1 patients having 1 or 2 copies. As I've explained, that type 2 usually have 3 copies, type 3 patients have 3 to 4 copies, and 0 copies of SMN2 is embryonically lethal. So you can imagine that how much it is dangerous, or it is associated with SMA type 0. So individuals who have more than usually 2 copies of SMN2 gene usually don't inherit the extra copies from a parent. They typically arise during a random error when making new copies of DNA, that is replication in an egg or sperm cell, or just after fertilization. Next. So less than 5% of infantile SMA is non-SMA related. So let me introduce the term infantile SMA variants. It is also called SMA plus syndrome, in which additional clinical features may be evident, including arthrogryposis abnormalities of extraocular movements, brainstem signs, or cardiomyopathy. These are characterized by congenital hypotonia, progressive postnatal weakness, and areflexia with anterior horn cell degeneration. So, again, a dangerous one. Next, please. In this diagram, you can appreciate the proposed mechanisms underlying SMA. The concept that the pathogenesis of SMA is associated with ubiquitously expressed proteins involved in the diverse cellular pathway. Here you can appreciate that these pathways are reinforced by mechanisms underlying neurodegeneration in non-SMN SMA. So mutations in SMA-related genes are associated with DNA metabolism, RNA metabolism, further with protein synthesis, axonal guidance, transport, protein misfolding. Here you can also appreciate degradation pathways, ion channel functions, and energy production. So these diverse functional pathways suggest that motor neuron degeneration may be a final common outcome with a number of upstream causes. Next, please. Now let's come to the immunological aspects of SMA. Number of immune cells are present in our body. Number of immune organs are involved that make up the immune system. So keep in mind that the previous experiments that were done to study the immunological aspects of SMA, they are done on the SMA mouse models. So lymphoid organs defects are actually a consistent feature in different SMA mouse models, and the major abnormality is seen in the spleen size. Once there is reduction in the spleen size, there is reduction of red pulp area, loss of clear white pulp or red pulp borders, loss of B cell follicles. So in such patients, you can also see co-infections of encapsulated bacteria like Mycobacterium tuberculosis. They are more prone to Streptococcus pneumoniae and also to Staphylococcus aureus. So they are asplenic patients are actually immunodeficient. Then in mouse models, we also appreciate that there is thinning in the cortex of another immune organ known as thymus, and thymus is basically involved in the maturation of T cells. So once there is cortex thinning in the thymus, there will be increased apoptotic models, bodies in the mouse models. T cell development get disturbed. Keep in mind that B cells and T cells, they play a very important role in our immune system. Other immune organs also get involved, like lymph nodes, mucosal associated lymphoid tissues, Peyer's patches, adenoids, tonsils, and many more. So impaired immunity is associated with neuroinflammation in SMA as well. Next, please. Oh, here you can appreciate that once there is depletion in SMN proteins, either there is defect in SMN1 gene or in SMN2 gene, here you can appreciate that thymus, which is very much important in cell-mediated immunity, an important part of the adaptive immunity. Once there is cortex thinning, there will be impaired T cell development. Once there is reduction in the spleen size, you can appreciate atrophy, abnormal histological structures, loss of B cell development, loss of B cell follicles. There will be fibrosis, smooth muscle cell clumping, abnormal in SMA patients, which is mostly seen. There is also abnormality in bone marrow. Once there is abnormality in bone marrow, all blood cells get disturbed because bone marrow is actually the part where the process of hematopoiesis get involved. Secondary lymphoid organs are also involved. Now, next move to the next slide, please. So immune cells that are studied so far are astrocytes, microglia, T cells, macrophages, and they are actually involved in the defective immune organs in immune cells that to protect, how to protect the SMA patients. Next, please. So here you can appreciate here you can appreciate that vasculature, innervation, cell intrinsic defects, proliferation, apoptosis, homic chemokinase, could all lead to small spleen size. So you can appreciate that once there is consequences of small spleen size, there will be neuroinflammation, impaired immunity, iron hematopoiesis defects, and here macrophages are involved in iron recycling and in depleted SMA. So thank you so much, because Ms. Walsh has already explained the process of genetics screening, little bit about the management resources, diagnosis. So I conclude that SMA is a devastating genetic neuromuscular disorder, and disruption of SMN1 gene is the causative gene that shared altered RNA processing and axonal transport. Thank you so much. If there is any question.
Dr. Nagin, I have one thing to ask. Thank you so much. Finally, your slides work very well, and we're very
Thank
much
God.
interested. Okay, my question is a recent discovery, which is more into looking at the hypoxic level of the neuronal cell lines, in which they assume the complexes of SMN, which is gems and nasal bodies, which actually when you have this protein SMN, which is coming from these two genes, which is called the survival motor neuron protein. So this actually come up with different complexes, which makes nasal bodies and also the jams and all those kind of things. So recently they found, just to want to add in, recently found if it's a hypoxia. So this hypoxia is one of the reason why the complexes are not being synthesized properly, even looking at the level of the full length functional protein coming from the SMN2, which is normally uh, 20 considered to be 10% versus 40% for the SMN1, is still there, but it is not working because of that hypoxic level. So one of my question basically is looking at the hypoxic, the pathways. We have the NFKB, sorry, starting with hypoxia inducible factor, then you got NFKB, then you got TNF alpha. So do you think there could be a relation, looking into that immunogenic pattern with respect to all these immune cells?
Yes, Dr. Atif, SMA is actually a multifactorial disorder, and it involves multiple organs, and I've told that it also involves the immune cells, organs. There's also a genetic aspect. So there's also an environmental aspect. And once there is disruption in the immune organs, in the immune cells, no doubt it will lead to neuroinflammation. And when I say that it is going to affect the axonal and the dendrites, and the whole system get disturbed, even the ion channels, and no doubt the hypoxia can even take place, but it is not always in all patients, but it can be one of the aspects.
I see. Okay, okay. Thank you, Dr. Nagin. Thank you
Thank you.
so much for your
Thank you so much, Dr. Atif.
We have one more question from because we are running out of the time. Actually, we are already 5 minutes ahead. Fatma, Dr. Fatma, you want to ask some question?
As
Fatma, there's a,
how is it that corporate
Yes, thank you, Dr. Fatma. It's a wonderful question. Yes, I can hear you. Let me answer your question, Dr. Fatma. It's a wonderful question. As I have told you, that SMN1 gene is basically involved in making up the SMN proteins. Once there is defect in the SMN1 gene, then SMN2 genes, it copes with the severity of the disease. If there are more numbers of SMN2 gene in the individual, it will cope with the condition of SMN1 mutation. So in other words, it will cope with the SMN1 gene mutation, and it helps to make the severity lesser in the patients by producing SMN
Dr.
proteins
Dr.
more.
Nagin, if you allow me, can I just supplement your answer?
Yeah, sure.
But Fatma, what actually is the issue? You have to understand we do have basically the transcriptional regulation and we do have the splicing regulation. What we mean by splicing is when we talk about the gene. Before the gene, we have the promoter region in which actually the whole machinery of transcriptome, everything is binding. One of the very serious issue with SMN1 versus SMN2 is basically a minor differences in the promoter region of both the genes. So there is a chance in some patients, even though the SMN2, the copy number is high, but the promoter where all the RNA polymerases, everything bind to give the expression, the baseline expression is not working. So this is one of the very big reasons why the expression, because we are not talking about the number of genes, we are actually talking about the level of functional protein which is coming from those genes. So if the genes are there, but the proteins are not there, still the things will not work out.
Here I also want to add the SMN protein, which I'm telling you, is actually a process of translation. This is how the protein is formed for basic people. This is actually the process of translation, that how it forms. So the SMN protein, which is produced by SMN2 gene, it can help to make up for the protein deficiency which is caused by SMN1 gene mutation. So there will be less severity as well in such patients if there are more copies of SMN2 gene. So translation is actually a process by which SMN proteins are formed, and it is a complex pathway.
Dr. Nagin, Madhya. I wanted to, even though Dr. Atif explained it well, but I think what Fatma is trying to ask is basically a child with two SMN copies, two children with same SMN2 copies. One will have symptoms way later, and one will be, diagnosed like 2-3 weeks into birth. So that variation is what I guess he's trying to understand. That same number of SMN2 copies can vary in severity as well, and I guess that's the topic for research.
I think we can also
Yeah.
request Prof. Zabidi, if Prof is still around. Prof, your conclusive comment on this issue. I think Prof. So this is actually Madhya, it is possible actually, because we are not looking only at the what we call it, the molecular pathies. Basically it's all about the whole body. And yes, we are in an era which we actually treat our genes and proteins, but remember the function of the survival of motor neuron protein is not specific only to the anterior horn of the spinal cord. Anterior spinal cord is actually having a lot of protein complexes, and it is one of the biggest protein, with some other protein which is actually bringing in all the proteins together like a complexes. So once it is affected, the level of severity it is affected, and how those proteins are being formed, like, at the molecular level, it is actually giving you the reflection in your clinical severity. So this is 100% possible. What actually Fatma asked for, it's 100% possible.
Yes, in other words, the copies of SMN2 genes, they are inversely proportional to the severity of SMA. If there are high copies of SMN2 gene, the severity of SMA will decrease.
For
This is
you're
the
still around, for
Yes, I'm here.
for us, so please, because we are already rushing out of time now. So can you
Okay.
request some Prof of, yeah.
I'm not so sure whether Prof is still with us, although he is.
So then if Prof is not there, you can request the respective speakers to give their conclusive statements so that we can pack up, inshallah.
Okay, thank you again, Dr. Najee, and we are about to closing up our session. Prof. Zabidi, are you still with us? Or maybe you can give us closing remarks. By waiting for Zabidi to reply us, I have posted in the chat box a form attendees form. So I would like to ask all the participants tonight to fill in the attendee form so that we can disseminate the certificate for today's webinar.
And for those who attended actually and they are missing, we will just email all of you.
Yeah.
So based on your presence in the WebEx, the records are there. So we'll just give the certificates to those people.
So, Prof.
Hello, Professor Bidi here.
Alhamdulillah, Prof is
Yes,
there.
and thank you
Alhamdulillah.
very much for Sapura and the team for organizing this. I'm really very happy to be involved in the discussion. We look forward to having more such discussions in the future. And my homework will be to find out to create a project of like what we have just said earlier on the issue of nutrition, because we've got a very, very good nutritional team in the International Medical University here. So
Inshallah,
please
Prof.
remind me to follow up on that. Yeah?
Inshallah, Prof. Thank you so much, Prof.
Thank you so much, Prof. So,
Can we get some last conclusive points from any of the speakers want to say something? Otherwise, we can just pack up for a.
yeah, we open to any speakers to add.
Even to the participant, if any questions they want to, just last 5 minutes.
Come again, Prof. Prahatir?
I'm saying even to the participants, if they want to ask any questions from any of the speakers, we have the last 4 to 5 minutes.
Yeah. Yeah, to echo what Prof. Atif said just now, I open the floor for any participant to speak up or to send any chat in the chat box, any questions to the speakers.
Hi, hello, Dr. Atif and Siti. Thank you so much. I just want to add one last remark because I am very delighted that in Pakistan SMA community has started moving, and I really hope that you all do wonderful advocacy and bring the treatment to all the children here. And just I would suggest that August is a SMA awareness month. If you can continue your awareness activities in that month to create more awareness throughout your country, it will be really helpful in your advocacy aspect, because a lot of treatments are coming in to the in Pakistan as well as. So use the month of August as the best platform
Yes,
to.
ma'am.
Yeah.
We actually like what Prof. Zabidi said. We actually have been. He used to be our mentor for a long time. We always feel motivation and disciplines goes hand in hand. So we will try our best to motivate the team all the time, inshallah. So in fact, even Pakistan SMA, even Malaysian SMA is like same body, inshallah. So we will plan like to come up with Indian SMA for some new SOP, some new guidelines, like what Prof has planned for the nutritional point of view. We're coming up with new guidelines and we'll be sharing with you also, inshallah. So next month, inshallah, we'll be coming up with our new talk on SMA. It will be a second part of our series and we'll move on for the next 5 months, inshallah. So that is our plan actually, to just have a proper motivation for all the group, all the caretakers, and all the patients. So might we'll get attract some like Casper was today here with us, but I think he's also busy in another meeting at the same time, so he couldn't speak much. But he did call me. We have talked for like half an hour talking about all this clinical trial thing, and all the stuff. So we will be inshallah aligned back with the positive possibilities.
Prof. Atif, this Miss Fadia Wahi asking whether there is any consent issues, if she would like to, if we can share the slides to the.
We have no issue. I hope like none of the speakers will mind because it's for the betterment of the SMA community. I think would be no issue. But let us just formally, as per rules, let us just ask them once
Yeah,
as per documentation. Then we'll get back to you.
sure. Okay. So this is the end of the first webinar of International Symposium of Spinal Muscular Atrophy. I'm thankful to all the speakers, the guests from Zabidi, from Sifale, and participants to this event, and also Prof. Atif Amin Bey. Thank you so much.
Thank you so much, Afura, for all your hard work. You know, you've been talking 2 days again and again. Thank you so much for everything.
Thank you so much for this opportunity. This is my first time being a
It was very
chairperson.
good, Alhamdulillah. You did quite very well.
Okay, thank you, Prof. So on behalf of the organizing team, I thank you all for making time in your busy schedule to join us here tonight. I wish you all a pleasant night. Thank you. Bahut shukriya.
Thank you. Shukriya. Assalamu alaikum.
Assalamualaikum.
Fura, you have to finish the meeting because you are a host, you know?
Yes, yes.
Okay, just finish the meeting.